He's a busy guy, so we're going to get right to him. He is Dr. Edward McDowell, and, of course, we're talking during Cardiology Month with experts from IRMC. It's Heart Health Awareness Month. Cardiologist Dr. McDowell with us this morning, and it's good to catch up with him once more on this Wednesday morning. Our conversation brought to you by Marcus & Mack, a law firm representing injured people. Dr. McDowell, good morning.
Good morning, Todd. How are you?
Wonderful, and it's good to have you with us here today as we get through the topics of concerning heart health, and they are varied, aren't they? I mean, there's practically nothing within the human system that does not have some correlation to your heart health.
You're absolutely right there, and the way people present with the symptoms of heart problems can vary quite a bit, too. In addition, we've seen some cardiac complications related to all the COVID that we've been seeing, a lot of atrial fibrillation, a lot of heart failure, things like that.
Well, it's interesting you say that because I was going to ask you about that right off the bat today. With this COVID-19 research now coming in, the data is available. I'm sure, on the inside of the heart health issues and cardiology, you see all of the studies that are being done as well. Is this a permanent thing, that the damage that COVID can do to someone's heart? I assume that it is when somebody already has a heart that's at risk.
Well, atrial fibrillation is a pretty common complication of a lot of medical illnesses, and it's certainly not life-threatening in most cases. However, the congestive heart failure is often actually the cause of death in a lot of these ICU patients on the ventilator. So some of them don't recover. Some of them don't recover.
Yeah. And we've heard that term congestive heart failure a lot in this month. IRMC's taken a special interest in congestive heart failure as an overall topic, and in fact, establishing new care protocols for congestive heart failure. It must be pretty exciting to you to see that happening.
Oh, it is. And, part of some of the exciting things that are going on here is there's a lot of recruiting going on. In fact, just yesterday, Dr. Darryl Rubin agreed to come and join us, so we're now up to 4 cardiologists. Our goal, however, would be up to 5 or 6. And hopefully what we can do is be a little more comprehensive in our treatment of heart failure and maybe even have a heart failure clinic.
Mm-hmm. Expand on that a little bit. What would you like to see actually happen?
Well, a heart failure clinic is a way to intervene quickly when people start to retain fluid, make quick changes in their medicines. So often with heart failure, people sit at home until they get so bad that when they come to the emergency room, there's no alternative but to admit them for a few days. Mm-hmm. And so, no one likes that. Everyone would like to nip it in the bud a little bit earlier and maybe prevent a hospital admission or a readmission.
Yeah, and I would guess that as people further complicate their heart health by sitting around, that it becomes a much more difficult treatment procedure in order to get someone back to full health if they're going to wait. People shouldn't wait when it comes to their heart health.
Sure. Yeah, I agree with you on that. And, you touch on a good point, too, that unfortunately a lot of the underlying behaviors don't change when people get heart failure, and so they continue to be risk factors. Uncontrolled hypertension, diabetes, smoking, obesity, even treating sleep apnea has become important in controlling heart failure and atrial fibrillation and other cardiac problems. This touches back on your initial comment about how heart disease affects all parts of the body.
Mm-hmm. Dr. Edward McDowell on the line with us this morning. We're talking about heart health today. So take me back to the very basic fundamentals of a normal person who does not have maybe a history of heart problems or heart problems even within their family, and when they should begin to really pay extra attention to their heart health. Is it done by age? Or are there other factors involved? When should we start thinking about heart health?
Oh, as children. If you look around, you see that obesity has really become epidemic, and that's a major factor. That also contributes to sleep apnea and, the comment I just made. Mm-hmm. So, no, it's never too early, and the average American diet is still pretty poor.
Yeah, that's absolutely true, and it leads to complications. So who should seek routine care? What should be the normal routine that we follow in terms of appearances at our heart doctors and our primary care physicians as well? Because I'm assuming that's where all of this would start.
Sure. First off, everyone in this category should have a primary care physician. And I think if they develop symptoms that they are concerned might be related to the heart, they should always start with their primary care doctor for several reasons. Not everyone needs to see a specialist. So the primary care physicians can take care of probably 90% of the heart problems that we see, particularly things like hypertension, that sort of thing. And they can begin the diagnostic workup, which sometimes involves a stress test, sometimes involves an echocardiogram. There are times when it even requires heart catheterization to completely characterize the nature of the patient's illness.
So that primary care physician becomes a really key link in the chain, and you, of course, as a cardiologist and people in your position, you become a very important part of that as well. So the people who come to see a cardiologist, what are some of the common things that the primary care physician is looking for that would say to that primary care physician, this person needs to see a cardiologist, so I'm going to set him up?
Mm-hmm. Well, physicians vary. Our training is not identical, and so some doctors feel more comfortable with certain problems than others. So that might be one issue if the doctor isn't real familiar with that. Second, perhaps if it's an unusual condition, that might be a reason for referral. Third, if in spite of the initial treatment the patient continues to worsen, that would be a typical reason then to refer on to a specialist.
The cardiology team at IRMC covers a lot of ground and does a lot of things. The various services offered by IRMC, and the cath lab is a big part of this as well. Could you discuss exactly what the cardiology team concept is all about?
Sure. So just on the cath lab, we have a very successful interventional cardiology program that's done in support with Butler Hospital, and that's been a very good working relationship, two community hospitals trying to help each other out. So we have, even as specialists, we have different interests and different strengths. For example, Dr. Frazier in our group is not only a cardiologist, but she has additional training in heart rhythm problems, what we call cardiac electrophysiology. So we often get some of the rhythm problems to see her. We have non-invasive cardiologists. I'm one of those who spend a lot of time doing electrocardiograms, stress tests, echoes, and of course we all see patients in the hospital. We have 3 excellent physician assistants. The nurses on 7-telemetry and ICU are a big part of the team. The cath lab employees are just terrific, and the interventional cardiologists are always very complimentary of that part of the team. We also have a cardiac rehab program with their staff, and we'd probably even like to expand that some in the future in terms of wellness, in terms of prevention of heart disease. So that would bring even some additional people into the team. Also, dietitians represent an important part of that team.
Yeah.
So it is. You're right, Todd. It is quite a few people here that are involved in heart care.
It's comprehensive, and you have to work as a team, and I know that you do, and you do that very well. You're all very comfortable with each other. You mentioned a couple of conditions earlier that I think we need to pay special attention to. One, you mentioned diabetes, and the other you mentioned high blood pressure. What are the connections between those two conditions and your heart health?
Well, both cause other heart problems. A lot of how diabetes is hard on us is through microvascular disease, whether that's in the heart or the kidney or the eye or the peripheral nerves. A lot of the damage is mediated that way. So a long-standing diabetic has a markedly increased chance of developing coronary artery disease, peripheral arterial disease, kidney failure, things like that. Hypertension has its own risks. It certainly accelerates the risk of developing coronary artery disease, but it also puts a mechanical strain on the heart, so that a lot of patients with untreated or poorly treated hypertension will develop what's called left ventricular hypertrophy. That's an increased thickness of the heart muscle related to the blood pressure. That might sound like a good thing. A thick heart muscle is better, but it often becomes stiff and non-compliant. And just like diabetes, hypertension can end up leading to congestive heart failure, which is a much more advanced kind of problem than just hypertension alone.
I want to ask you something as well. We don't have much time left, but this has always been a curiosity to me because I have an uncle who has been told this, and I've heard of others being told this as well. They're told at some point as their heart problems get worse, 30%, 40%, whatever the percentage is of your heart is just dead. It's not functioning anymore. And so you're on borrowed time. Is that always the case? And does it actually get to the point where the heart just portions of it can shut down and the rest can continue to function?
Oh, sure. Most particularly when someone has had a heart attack, that often selectively damages one segment of the heart muscle. A typical heart attack comes in, very often it's one artery that's closed off. Now, we try to get those people to the cath lab very quickly to get that artery open, but sometimes we're not successful in preventing that heart attack. Other heart problems, particularly diabetes and hypertension, might lead to a more global problem with heart function. A lot of patients are curious about their number. A lot of them want to know, what's my ejection fraction? And while that's important, how the patient is doing clinically is much more important than the number.
Mm-hmm. Dr. Edward McDowell, our guest this morning. We've been talking about heart health. It is Heart Health Awareness Month, and the IRMC cardiology team hard at work helping folks. For people who want to know more about their heart health, about what IRMC's cardiology department is able to offer to them, I'm sure there are great resources, and online is one of those. But let's talk as well about getting yourself established with a cardiologist, at what point that's the prudent path to take, and how it is done.
Well, like I touched on this earlier, I think in most cases a patient can trust the judgment of their primary care physician to decide when they need to see a cardiologist. Now, the exception to that might be, for example, someone who moves to our community who already had a valve replacement, maybe a defibrillator, complex heart disease, and they had a cardiologist where they lived before. I mean, in almost every case, that patient's new primary care physician is going to want them to see cardiology. So, and we have a lot of that. People move to our community with pre-existing problems. So, but again, in most cases, a referral from the primary care physician is the best way to get plugged in with the cardiology service line.
He is Dr. Edward McDowell, joining us here this morning on Indiana in the Morning. Thanks so much for spending some time with us.
Thank you, Todd, and thank you for the interest in heart disease and doing your part to help us prevent it.
We're doing our best. You're doing the hard work. Have a great day today.
Thank you, Todd. Goodbye.
Bye now. It is the voice of Indiana County, WCCS 101.1 FM and AM 1160 and AM 1160 and